Hello and welcome to our much awaited IGTV series on Meet the Experts. And today I am really excited to be here to talk to Dr. Jayashree Gajraj, who is a senior obstetrician and gynecologist from Chennai. And she's going to talk to us a little bit about making sure that you're taking care of your postpartum body the right way. Thank you so much, Dr. Jayashree, for joining me today.
Hello, Sonali. Nice to see you after a long time.
Thank you.
These are difficult times for us, and it's so nice that we can meet each other at least online and meet our patients. It's thanks to technology. I think we shouldn't complain about it at all.
Absolutely, it seemed like a bane, but now it's almost a boon with access, and also with telehealth becoming the next big thing. I think a lot of the consultations are happening online now, right?
True. But being a new culture, I think both doctors and patients need to understand, the implications and what it is. So that may take some time, but definitely it will help. And the way forward, I think, is this.
Yes, and I think in spite of, in the past, I think we would have hesitated, but now we are forced to adapt. And I feel that there are some major benefits, definitely. Even though it's a profession where we need to be physically present a lot of times.
Exactly.
So
we are feeling that right now because in spite of all the phone consultations, the WhatsApp, the online, and also teleconsults, we still can't do the deliveries online. We have to do it.
So, doctor, I wanted to actually talk to you about postpartum. Let's start with what the current situation is at. So, how soon after birth are women discharged post vaginal birth and post C-section?
Yeah, you're absolutely right there because we are trying our best to send women home earlier. I mean, as soon as we are convinced that they are fit to go home, we're sending them home. Perhaps even 24 hours earlier than we would normally have done. Right. And this is again just to reduce the exposure and the viral load for them.
Absolutely, yeah.
So, which means that there are certain things that we need to counsel them about, because some of it they may have to go home and take care of. Now, after a normal delivery, it would normally be anything after 24 hours within 48 hours. But
Right.
Now I think we're going nearer 24 hours rather than 48 hours. Section, I personally, my team, we used to send them home at about third post-op day. But now we're trying to send them home by second post-op day. Now, in a normal delivery, the implications are for the mother and the baby.
Right.
Now, for the mom itself, the most important thing is care of the episiotomy wound, because many a time they may have a cut called the episiotomy, which we need to take care of. So we have to tell them a little more in detail about how to take care of the episiotomy wound, not to use any antiseptics. Most obstetric units would actually give them an ointment to use. So they can continue using that, wash the area well, keep it dry, and report if there is any pain.
Okay.
And most of them will be given some painkillers when they go home. We suggest that they use it at least for 3 days minimum.
Okay.
And the more active they are, the less pain they will have in the episiotomy wound. Then the next thing would be the bleeding. Now, after going home 2-3 days later, she could have a sudden gush of blood and some clots, and they would panic.
Right.
Now, this need not necessarily be dangerous or significant. Yeah. So we just warn them about it, and if they tell them that if there's anything more concerning or they themselves are worried, irrespective of the quantity, to call us.
Okay, doctor. So usually if it is more than the size of a golf ball, from what I understand, very large clots.
Big clots
would be concerning.
And severe pain also associated. There will be some degree of pain, especially when they are breastfeeding.
Right.
But if it's severe pain and they are passing clots or tissue-like material, then they have to call the doctor.
Report back. Okay.
And the third thing is, of course, lactation. But I'm sure you will be going into in detail. So little doubts they may have about the milk formation. If they are in hospital for 48 hours, that gives them sufficient time for lactation to get established.
Right.
If you send them home earlier, it may not be well established. Baby may not have latched on well. So we tell them to keep in touch with us so that we can guide them about that.
Okay. Yes, I foresee a lot of those cases because engorgement being one of the issues. Once they're home, there
True.
could be a lot of milk suddenly coming in, and then that could cause so much concern.